So today I'm going to tell you a little bit about what I do as a physical therapist. My name is Justine Calderwood. I'm a women's health physical therapist. I'm a birth healing specialist as well. I work primarily with pregnant and postpartum moms. And I'm going to tell you a little bit about how we assess here at the Healing Spot for urinary incontinence and what the treatment entails, okay? So first of all, I just want to say, before we even jump into looking at anything and doing an evaluation, what we do first and foremost is talk to people on the phone. So we really have a phone consultation to make sure that we are, we can actually understand, or that we understand your problem and that we can actually help you. So that's where we start. And then, after that phone consultation, if you qualify for it, we may offer you a discovery session where you sit down face to face with us and get any more questions answered. But we kind of start with that, okay? So by the time a new patient shows up, in our office, by that time we've already gotten a lot of information from you. We've already talked to you in depth because we here at the Healing Spot really look at our patients as whole people. So we really want to know what's going on with you, what's happened in the past, a little bit of information so that we can be absolutely confident that we can help you, okay, when you actually come in to see us. So we look beyond just that diagnosis of incontinence, okay? So once you do end up in this first session, by that time you filled out even a little bit more paperwork, give us even more specifics on dates and some of your history, because what you might not think is related to your urinary incontinence, we may be able to, as specialists, be able to help guide you in that, and also help you see really how the urinary incontinence started and how we're going to treat it. We see our patients really as individuals, okay? So no two people just get the exact same thing here at the Healing Spot, okay? So by the time you do come in, this is kind of probably why you're tuning in right now. What are we going to do that first session? What do you do as a pelvic floor physical therapist, as a women's health physical therapist? Am I gonna have to be naked? Anything like that? Am I gonna have to take my clothes off? So when we start, what we do is we start with a standing assessment. We're going to look at your posture, and what you would be wearing at that point is a pair of shorts and either a tank top or like a sports bra, because we want to be able to really take a step back and look at your posture, because that tells us a lot of information about you, about where your body is pulled out of alignment, where those restrictions or those kind of sticky spots in your body might be that may be contributing to your urinary incontinence. We don't just look at what's the strength of your pelvic floor. A lot of people are told, hey, just do Kegels. Oh, you're leaking, just do Kegels. Well, that's not what everybody needs, because some people absolutely already have a strong core and strong pelvic floor muscles, but they have poor posture, or they're still kind of in what we call an open birthing pattern because they were pregnant, they've had babies, and maybe it's even been many, many years ago, but their body is still holding on to this, okay? So we start with a standing assessment and just look at you from the front, from each side, and from the back, and we're gathering information and we're telling you what we see, okay? So we gather a lot of information just by looking. And again, we're looking at you as a whole. And then our assessment is going to involve some feeling, okay? So we gather information through our hands. So that could look like, we start with you basically on your back, face up, and we start with looking at, I don't have anybody here with me to show you this, but I particularly start with looking at the pelvis. I see this as really being the center of your body. So any imbalances in the pelvis, what that looks like is going to affect the pelvic floor, okay, and how well your pelvic floor can support your bladder, okay? So we start with that. We start looking at doing some what we call like spring testing, side to side. Is one side not moving like the other side, okay? So it really goes beyond pain or where your symptoms are, because sometimes other places in your body are causing the dysfunction, okay? So we start with looking at mobility of the pelvis. We start at looking at mobility of the rib cage. Is your rib cage stacked on top of your pelvis, or is it still in this kind of rib thrust if you had a baby? Or maybe something else in your past, you had an injury, a sporting injury, you fell down, you fell off a horse, those kinds of things. We gather that information and we're checking to see how well your posture is, because if your body's out of alignment, it's going to start to put a lot of pressure down through the pelvis where your bladder is located. This shows a little bit more on, this is a female pelvis looking down. This is basically just this part of you. Spine would be stacked here. And the bladder sits right behind your pubic bone, okay? So you have these pelvic floor muscles kind of creating a hammock or support underneath. Well, the bladder sits right behind that pubic bone. Then you have your uterus. If you haven't had a hysterectomy, then you have your rectum, okay? So, you know, we look at how this bony structure is supporting, because if you have an imbalance there, let's say you have what we call like a rotation, an anterior rotation, you can imagine as I do that, what happens to the pelvic floor, okay? It twists, okay? It torques. And so absolutely that's going to affect the way that your muscles work. Take, for instance, I use this analogy a lot. Let's say you are tight, or you don't have the mobility, or you have abnormal mobility, say in your biceps, and you go to lift up. Like, let's say you only have this much mobility. You can't gather enough strength that you need to lift something, lift a box off the floor if you're limited in your mobility, or if you don't have the function that you need, okay? So it's no different with the pelvic floor. So we look for things like diastasis recti. You know, is that separation there? If you've had a baby, we look for that, because that's going to tell us a lot of information already about the integrity of your inner core, okay? How well your core is able to engage, okay? We look for things like, this is very specific to the Institute for Birth Healing, but the open birth pattern. This is taught by Lynn Schulte. I'm a certified birth healing specialist with her, and so looking really at the open birth pattern to see if your body, if you've had a baby, if it's still perceiving that it's birthing, okay? Again, no matter how long ago it's been. Rib cage and thoracic mobility, your spine. We're looking for things like pelvic organ prolapse. This tells us information on the integrity of the bladder itself, okay? I'm also feeling for any restrictions in the soft tissue, because think of the bladder as like a fluid-filled sac that's got to be able to fill up, and it's got to be able to empty. Well, if you have soft tissue restrictions around your bladder and it can't fill, like take for instance, like a water balloon. If you can't get that water balloon to fill up because it's tightened down with this straight jacket of soft tissue, then we got to release the soft tissue. So I'm telling you ladies, no amount of Kegels is going to change the soft tissue if it's a soft tissue issue, okay? It needs to be released first, and that's what we absolutely start with here at the Healing Spot. We rarely ever start with strengthening, okay? And Kegels in particular. All right, and then in time, we don't usually do this the first session, but in time we'll do an internal assessment. So as a women's health physical therapist, it's within my scope of practice, within our scope of practice, in order to test the integrity of the muscles internally. What that means is if you're a woman, we would talk to you about this ahead of time, educate you, get your permission, of course, and if you were in agreement for this, what we would do is actually check the muscles internally. So we would go through the vaginal opening with just one gloved finger. We go into the vaginal opening and we actually check how well those muscles are able to contract and support. Do they have the flexibility that they need? Going back to that bicep muscle, we can do kind of the equivalent there. We look for kind of the springiness of those muscles side to side to see, is one side more restricted than the other. We gather information about your birth story. If you are a mom, tell me more about the birth, because we know that these tissues and these muscles, particularly the bladder and that, can hold birth trauma. So again, we look at you as a whole here. We're going to go through that birth story, and we're going to help you release very gently any of that trauma that could be stored from birth, from prior injuries, from abuse, from any of that, okay? So let's see, that's kind of our assessment. That doesn't all happen on day one. We do what we can. It's kind of this running assessment. As you come back, maybe we do the internal assessment, maybe by visit 2 or 3, you're ready for that, okay? So it's all customized based on our patients. We don't have this cookie cutter like set thing that we do, okay? So as far as treatment, we talk about 3 different phases of treatment. The first phase is going to be helping you relieve your symptoms. Going back to what we find in our evaluation, that's what we're going to treat. So if it's a posture issue, if it's a soft tissue issue, and they're not, the soft tissue isn't gliding like it needs to, it's not allowing the bladder to fill up, we're going to do some release work, okay? So a lot of it is based on kind of that symptom to begin with, but then we go into phase 2. So this is a process. We don't see people for 1 or 2 sessions because we know it takes longer than that, okay? So phase 2 is going to be once we get the alignment back, we start to get the mobility back where it needs to through the joints. Then what we're going to do is start to start to build the inner core strength. So we're going to start to build, I tell people it's kind of like building a house. We've got to build that foundation first, bring an awareness to what are the inner core muscles? How do I engage them? How do I do a Kegel properly? And I'm giving my patients feedback on that. Really, in my opinion, the only way to really check strength of the pelvic floor is to actually go up in there and do a squeeze around like a finger. How are you going to know? I know there's biofeedback machines on that. I personally like to use manual feedback because my patients aren't going home with the machine. Okay, so I can give them that feedback. I can teach them how they can check for that themselves. But we're going to build that foundation. And then phase 3, we're going to be working on functional things. So do you want to run? Do you want to go work out? Do you want to run a half marathon? Do you want to take care of your kids? Do you want to push a stroller? Do you want to wear a baby on your back? Do you just, maybe you're an older lady and you're like, I just want to make sure that I don't pee my pants when I go to Hobby Lobby to go shopping. Okay, so phase 3 really is looking at those overall goals that you have, long-term goals, and preventing reoccurrence. Okay, if we stop too soon, guess what, ladies? You may slide right back. Okay, so we want to make sure that we get through all 3 phases, and we start to talk about that with you very early on in treatment. What does that look like? How many sessions are we looking at? What's the cost going to be? So that you can prepare for that and you can plan accordingly. So I know I gave you a lot of information today. I would be more than happy to talk to you if you want to go to my website, go to our website at healingspotpt.com, look at the women's health under services, look at women's health, and you can even fill out an inquiry form. Tell us a little bit about you. What are you struggling with? What do you have questions with? So we can give you a call back and we can talk about how we might be able to help you, or if we can be able to help you, and you can make a more informed decision if you want to come to the Healing Spot for some help and to solve your problem. Okay, so inquiry form on the website you can fill out. Also, that discovery session, we'll be in contact with you to see if you qualify for that. Otherwise, leave your questions below. We'd be happy to answer them, and thank you so much for your time.